going to demonstrate pulling blood on a cow. So we have a nice paper towel here. I'm just going to pull up on her tail, clean this area right here. Just in case she pulls it out of my hand, I kind of wipe down there as well. So I have two different options here. I have a Vacutainer or I have a needle and syringe. If you can see all of these, one's an 18 gauge, one is a 20 gauge. I'm actually going to use the Vacutainer today, but a needle and syringe can work just as well. So I will hand off the needle and syringe. Take the lid off of my Vacutainer. So you want to go about a hand's width behind where the tail attaches to the body. So about right here, right on midline. You can feel a bone on one side, a bone on the other, and you want to go right in the middle. So I stick that in, and then I attach my tube, and you can see that it nicely fills with blood. You go all the way down into the bone, and you just pull back a touch. Again, apologies for the babies. Great, so you let the tube fill. You do not overfill these tubes. It only needs about an inch of blood. Pop out your tube, take out your needle, and you're all done. Today I'm going to demonstrate pulling blood with a needle and syringe versus a Vacutainer, which I've demonstrated previously. I have an 18 gauge, a 20 gauge works well too. Break the seal on your syringe. You really only need a 3cc syringe. You're not going to use more than 2 mils to fill your tube. What's important is after you get your blood, don't overfill your tube. There's actually a line on the tubes, and so there's only enough of the product in here to fill it up to that line. Do not overfill. So the first thing I'm going to do, I take a paper towel, wipe off any dirt that you have. It's kind of a myth when people use alcohol. You actually have to wait for the alcohol to dry to have any effect. So this is just as effective. Go a hand width behind where the tail attaches, where your index finger lies. You can feel bone on both sides, right on midline. So you want to go just right on midline, all the way in. You jump a little bit. The part that hurts is going through the skin. So if you have to redirect a little, that's fine. And then you just gently pull back. So I went all the way into bone, backed out just a touch, found the sweet spot pretty easy. You do not need more than a couple of mils. I hold it off just for a second, but you don't have a ton of time to get it into this tube before it starts clotting. So I'm going to show you here. These will automatically fill. Invert them a couple of times up and down to mix the solution that's in there. And you can see it automatically filled and did not go above that black line, which is perfect. They literally need a tiny drop to do almost any test that you'll use. Invert it gently a few more times. And then if you're going to be shipping this, store it in the refrigerator overnight, ship them on an ice pack. You don't want them to freeze, but an ice pack in a shipping box works well. On my website, www.rosewoodfarm.com, rosewoodfarmkc.com, I have some great instructions on how to ship to a lab and process your samples. So that's all for today.